Okay. And really for you, are you a FLOC?
I'm a FLOC.
Okay.
Yeah.
So
I'm a nurse practitioner in the CCU, yeah.
Okay, great. So from a FLOC perspective, we want to hear sort of how you partner with nursing around preventing central line infections.
Sure. Do you want me to start? Okay.
Yeah.
So one of the things as a frontline ordering clinician, we partner with nursing. We've really given them a lot of ownership of the lines, and so we are very dependent on them, whether it's us asking for a blood draw off the line or rotating residents to sort of practice with a questioning attitude and come back to the ordering clinician and say, you know, do we have to draw off that line? What is your rationale? And sort of talk it through. And from a provider standpoint, you know, the nurse practitioner team is really a stationary team in the CCU, and so for our rotating residents, we orient them at the beginning of their rotation. And one of the things that we discuss with them is our sort of line protocol and, you know, the rationale for not pulling off lines and the extenuating circumstances where we will pull off a line. And so the nurse practitioner group in the CCU really provides a memory for the unit, and along with nursing helps to support standard of practice for all providers, meaning attendings that float through and residents and the like.
Great. So given the success that you've had in CCU, what advice might you give to other units that may be having more challenges with their CLABSI rates?
I think just from a provider standpoint, just being supportive in nursing and to support that dialogue, because I think that when people understand sort of the rationale behind the practice, it sort of sticks. So I think just continuing to support nursing having ownership of the line, and to if there is resistance among providers, to just open up the discussion to, you know, why, if it's challenges with parents who are requesting labs we draw off the line, you know, to have a conversation and to sort of weigh the risk and the benefits. And I think that if everybody's part of the conversation, you have a better you know, opportunity to be successful in sticking with the standards of care.
Do you participate in the rounding process that the nurses were talking about?
Just daily rounds?
Yes.
Or yeah, I mean, yeah, we are part of rounds, so that's something. Actually, I forgot about that, but part of rounds, nursing has a large role in sort of reviewing the numbers, any trends, any concerns, what we're going to sort of summarizing what the plan is for the day. So it's a great opportunity for us to discuss what the lines, what lines the patient has, and any issues that we're having with them, and also is just a forum for nurses to discuss if someone wants to draw off the line or whatnot. It gives, and parents, so it's a forum to have that conversation.
And then what does highly reliable care delivery mean to you?
Highly reliable care delivery means that it is care that is evidence-based, and that is standardized, and I guess those are the two things that come to mind.
Okay. Any other thoughts that you think are helpful?
And I guess buy-in, you know, it's buy-in from everybody. So buy-in from the multidisciplinary teams to you know, practice that standard and be supportive of it.
Great. Any questions?
I think you covered the high reliability, but so is there any techniques that you use when you're interacting with teams, like to kind of open up dialogue? Do you ever feel resistance to?
Oh, absolutely.
So how do you get beyond that?
Well, I think you know, one of the benefits that we have in the CCU is that we have had success with low collapse rates to no collapses at certain times. So I think that, and that the reason for that is that because of the standards that we put in place and because of the ownership we've given to nursing. So I think always going back to that example of, this is by drawing off the lines or not complying with the standards of care for lines, these are the risks that we open our patients up to. And so sort of drawing on our own experience, we have that privilege because we have had great success. So I think that's a nice way to sort of be gentle about the conversation, and it just supports the standard.
Perfect. I think that was
All
perfect.
right.
Thank you so much. No, it was absolutely perfect. And it's always great for these not to just be like nursing sort of
Right.
Yeah.
displays, because it really is a partnership and
Yeah, absolutely.
multidisciplinary team. So thank you for taking the time.
I guess the highly reliable care, I had to think, I was like, oh, I wasn't ready for that one, so I don't know what my
no, we're just throwing different, curveballs at
Yeah,
you
no,
here.
it's good.
Yeah,
It's
no,
good.
you
All
did a
right.
great job.
Yeah,
Thank you.
no problem.
I think we're good.
Thanks, Claire.
Thank you.
My 15 seconds.
Think we're done?